Well, today marks the start of Black Maternal Health Week. It's a time to raise awareness to the fact that Black women in the U.S. are dying from pregnancy-related causes at a much higher rate. According to the CDC, Black women are 3 times more likely to die during pregnancy or childbirth when compared with white women. And as part of this week focused on action and prevention, Northwestern Medicine is hosting a free educational session. It's Tuesday, April 15th at the Prentice Women's Hospital, and anyone who's pregnant or even considering pregnancy is encouraged to attend. And we're really grateful to have a doctor here in studio with us, Dr. Jackie Hairston, a maternal-fetal medicine specialist at Northwestern. Thank you for joining us to talk about this. It's so important right now to talk about.
It is, and we are kicking off Black Maternal Health Week. It's 2025 and the numbers are still stark. We really need to raise awareness, but also do our part as physicians as well as hospitals to really bring patients and potential patients to recognize what are your needs and how can we address them.
And is that what you're hoping to discuss at the event? What can people get out of it if they do go?
Everyone is welcome. You don't need to be a patient of Northwestern. We really want all community members to participate and hear about not only the myths around pregnancy, around epidurals, but how we can safely get you to the outcome of a safe mom and a safe baby.
And speaking of that, I really want to talk about the racial disparities when it comes to pregnancy-related deaths. Why are Black women dying at higher rates than white women?
We have to look at the history of America and the buildup and the legacy of systemic racism and the impact that it has, which can lead to mistrust, but it can also lead to bias in patient care. And so those combination of things can lead to that stark disparity, which is, as we know by the numbers, tremendous.
I've covered so many stories on just the disparities when it comes to medical care, even in our cities specifically, and depending on where you live and if there's a hospital nearby, if you have access to care. And it's just so important to talk about this. So if someone comes to the event, is this something that they can ask questions at the event, or is this something where you're kind of giving a presentation?
Yes, so from 5 to 7:30, we are having continuous tours of our labor and delivery, our postpartum units, but we'll have a segment where we're doing hot topic talks where we're talking about pelvic floor physical therapy. Am I high risk? What do I do if I'm experiencing infertility? And then after that, we'll have a 30-minute question and answer panel. So if you register, you will be able to submit questions that you want the panel to address, but on top of that, you will get free parking.
Oh, that's good. Good to know. Always helpful here, for sure. I've done a lot of stories as well with Black women who've also struggled with infertility, and they talked about how sometimes we just don't talk about it in families, and so sometimes you just think that you might be alone in it. So it's nice to have this community of support too, right?
And the latest data is showing that the teen pregnancy rate is lower than the rate of women who are over 40 getting pregnant, and people are advancing in their careers and then pursuing childbearing. We will have our infertility doctors there talking about infertility and what impact we can make before getting pregnant. How can we get our health conditions in order before pursuing pregnancy?
If someone's watching and they're wondering, what can I do to help reduce my risk if I'm pregnant or if I'm hoping to become pregnant, what is your message to them?
Yes, certainly in terms of pursuing pregnancy, we want to say if you have medical problems, we want you to meet with your doctors beforehand. See if your medications are safe in pregnancy. If you have high blood pressure, we want that under control because that's important, but also saying, what's been my history? Have I tried to get pregnant before? Have I struggled? Because the infertility doctors can do a workup to figure that out.
Last thing I do want to talk about. So I've struggled with this too, when you go into the doctor and you don't even know what to ask or where to start, and you leave and you're like, oh, I don't even know if I got the answer to that question. What's your advice for someone as they go into that office to know what to ask when it relates to this?
I think social media has brought forth a lot of issues that people think are a very high alert. So when you see those videos, take notes on the questions that you have. We are happy to address them. We want people to, yes, get ideas and thoughts from social media, but we really want to address the facts, and this event will help do that. We will have some viral videos that will show and address what is true and not so true about what we're seeing.
That is such a good idea, because sometimes it's just this over-influx of information and you're like, what can I believe out there? So thank you for the expert advice. We appreciate it, Dr. Jackie Hairston. Thank you for coming in here from Northwestern. We appreciate that so much.